Thank you, Lisa. Good morning, everyone. Seems we still got a lot of work to do. These are my disclosure. I'll be talking to you about how do you monitor patients after their discharge. My disclosure is not related to this talk. Well, I think we know the definition of same-day discharge by now. So it means that patient is not staying overnight. So it's less than 24 hours, but there's no night stay. And you know, when you look at 1970s or before then, patients used to stay like what, 7 days, 10 days, sometimes 20 days. But with enhanced recovery pathway and advances in minimally invasive surgery, we were able to cut this down to 2-3 days, and we're pretty excited about that. Now, talking about going home, you know, while this, you know, the ERAS protocol, our minimal invasive surgery, all the things that we're doing and expediting the process for patient going home, but there is like, are patient ready? Are we ready to discharge our patients? I mean, I know some of us check labs every day. We check CRP, hemoglobin. So these are the labs we check, and then get physical therapy for patient, education. So how are we overcoming all this, you know, aspect and saying, okay, now it's time for you to go home, and you're going home today. And we like, based on our previous talk, what is the patient perspective? So it's, it could be pretty scary, you know, sending those patients home that day. Anyway, so how can we make this transition smoother? I think it starts preoperatively. Education, education, education. I can't, you know, tell you how this is important. You have to sit with the patient and with the family member. So it's not just the patient that you're seeing and talking to. Talk about surgery. Like Dan mentioned, you know, show them pictures. This is what your surgery is gonna look like. This is what we're going to do. Set expectation. I think the expectation is very important. For instance, I tell my patient, you're gonna have loose stool probably for a few days. You may see a little blood, so for any single drop of blood, they won't come to the emergency room. So that expectation is important. And as we discussed, that social support, do they have a family member, friend, someone at home with them, and provide them with instruction. Now, what are some of the modalities? There is many out there, and you have to see what fits with you, your patient, and your institution. So there are home health, and we'll talk about that, telemedicine, you know, telephone assisted calls, and some mobile application. And hey, we're going forward, maybe artificial intelligence, who knows? So as far as home health care, it's great. You know, there is a collaboration between the physician and the nurse that goes, you know, to patient house. You know, they know what to expect, what they need to do. Family members are involved, they're in the house, and, you know, patient is staying at home. So there is a lot of, you know, pros to it, and it's a one-to-one attention between the caregiver and, you know, the patient. But, you know, there are some limitations. You know, what's their insurance? Can everyone get home health, you know, for the house? Or do we have enough staff? I mean, right now we're lacking staff in our hospital systems, you know, home health, you know, and everything. And, you know, that trust issue, do I want someone keep coming to my house every day? And it's not a 24/7 access. So, you know, it has its limitation, but also it has its pros. So for some, it may work and it may not. Then, you know, you have telemedicine and telehealth. As we're moving forward, there's a lot of mobile app that is coming out there. And Lawrence actually showed us, you know, as far as what's, you know, what are some of the, you know, mobile apps that are there. We're actually using Seamless now. And, you know, what it does, it provides patient, you know, preoperatively what they need to do, post-operatively, you know, checks on them, and it kind of follows the patient closely, and there is a relation between the, you know, healthcare staff and what's happening with a patient at home. So it depends what you have at your hospital. That is, you know, a possibility. And all of those information, you know, can get linked to your, depending to what you use in your hospital system, to an EHR information pathway. So it's ask about medication, what they have been taking, you know, it instructs them about their wound. Yeah, take a picture of your wound, and then they can send it to your nurse or to yourself to evaluate it. Have you gone out of bed? So these are some of the questions that ask the patient, and the patient is supposed to respond to that. And it gives recommendation, like if someone is having, bad diarrhea, hey, what color is your urine? Kind of assess if they're dehydrated or not, and can give, instruction of what to do. And also sends reminders, hey, did you change your dressing today? Where, you were supposed to do that. So you can modify it based on, the procedure that you have done. So this is just a schematic of like what we have. So you can see, from a wound standpoint, from pain score. So if there's they ask multiple questions and guides the patient to the next step. So let's say if patient says, I have a 101 fever and abdominal pain and my belly is like very firm, it says, hey, either go to ED or call your doctor right now. So there's some ways that can prevent patient, you can get access to that information of what's happening at home with patients. Dr. Lee and his colleagues, actually published this paper about this enhanced recovery pathway 2.0, which I like the name. So it was about 48 patients that they included, and they did a mobile app, follow-up with these patients. And, based on their conclusion, they had a significant reduction in patients, preventing them go to the emergency room. And patient actually used the app. And they were able to reliably, state, what are some of the, important symptoms that they have or concern, so it could be caught, faster, and which would avoid, frequent ED visits or readmissions. Because you don't want to send your patient home the same day and come back literally that night or the next day to the emergency room. That's not going to work very well. Well, we're talking about all these fancy stuff, but hey, what if there's no internet connection? Right? You're talking about these apps. Sorry, I don't have internet. And what if I don't have a smartphone? Do all of us have smartphone? I'm assuming in this room we do, but does all your patient do? And what do you got this old little cute guy, which doesn't know how to use these apps? So what are the options for that? If we want to implement this and we want to move forward, I know it's for selected patient, but there are some limitation to what we do. And there's also concern, for HIPAA and data privacy and so on and so forth. So there are options, other options like telephone appointment visits, which Dr. McLemore, sitting next to us, did these daily calls with their patient, with their staff for 7 days. When they would call, they would, ask questions about, what are you eating? How's your bowel movement, your pain score, bowel function, dietary advancement, and so on and so forth. And actually, that was a good way for them to monitor. And we've been actually doing the same thing. We've been calling patient day 1 and day 3 and see how they're doing. And usually they follow up within 7 to 10 days with one of our staff, either our PA or myself. I think there are some benefits with the telephone appointment visits. I think hearing your patient voice, it's really important, how they sound on the phone. It's like, better than what's on the app, at least sometimes to myself, I like to hear. You kind of get a knowledge of their status, and, you ask about their post-operative concerns and, anything that they have. And I think patients communicate maybe better on the phone with you, so that could be an option. But there are, limitation to this too, is time constraining. I mean, all of us are all over the place, we're short of staff, so having, call someone every day could be time, consuming. And you really can't examine the patient, know how they are, or sometimes you can't get hold of them, so you have to leave a message and keep calling back. So again, pros and cons, but these are, possibilities and options. Talking about AI, the future, there's not much out there, but this was a study actually by orthopedic surgeons that they did. It's machine learning, right? They know like what question to ask, what to look for, that voice recognition. And actually they were pretty successful. They called 236 patients and, compared to the phone visits, and actually showed, it was pretty much the same, even better. So I think that's maybe where the future is going with all and there's a lot of AI talks I know at this meeting. So again, in conclusion, yes, same-day discharge, in selected patient. I mean, today we're talking about selected patient. We don't know what tomorrow we're going to talk about, but it's safe. And, you know, patient could experience complication, and that's what we're worried about, but we have to have a plan. So I think based on who your patient is, what their family structure, where do they live, what do they have access, and who you are, what institution you work at, and what you have in your hospital system, then you can come up with the best approach how to monitor your patient. It's not one size fit all. You have to see what works for you guys and what works for that patient population that you're operating on. So hopefully we'll see more in the future. Thank you.